on the nuance of diet, why is there so many doctors that are still kind of, if you want to call it, keeping the party line, are still, pushing the drugs and not really interested in the results of the nuanced results of the labs and stuff to actually say, look, the problem might be sugar or the problem might be processed food?
The standards that define a good doctor, particularly in the United States, is based on, they call them HEDIS measures. And those HEDIS measures focus on quality of care. Advocate Health is one of the top quality organizations in the country where I work. And we are as effective at this as Mayo Clinic, Cleveland Clinic, etc. You may know those other names better because they do a little bit more research. So when you're publishing, you get more attention. So if I am defined by having somebody on a statin, if I'm defined by making sure a person had a foot exam if they have diabetes, if I'm defined by making sure they get a referral to the ophthalmologist, those things are not things that heal people. Those are just things that have been shown to show benefit. If I give them a medicine like Jardiance, which tells you to urinate out more glucose, then I'm considered a good doctor, although that medicine only reduces your A1C by 0.6 to 0.8, not even a full point. Oh, by the way, increase your risk for urine infection. Oh, by the way, it's not really the best diet if you're doing keto or carnivore because it increases your risk for something called euglycemic acidosis. So what I'm getting at is the things that we're measured by are not things that heal people. Now, if I was measured by my ability to get people off medicine, then I would focus on that. In fact, the way healthcare works in America, which is appropriate to a certain extent, is that we get paid more money the sicker a patient is. Now, that's good if you have a lot of sick patients, and you should be compensated for the time it takes to take care of those patients, then giving you more resources to maybe build things that support that, right? But wouldn't it also make sense to compensate a doctor who had a person on insulin, they're not on insulin, or they were on that Jardiance, now they're not on that? So there may be a way to do both, where you say, we're still going to pay people for sick patients because you got to, until they're not sick, you need to be compensated. But how about we reward doctors who take people off medicine? I know some countries do that, but that's been the issue. So doctors focus on what they're being told to focus on and what the insurers are going to pay you to focus on. So until we change the system, and we're going to continue to do that gradually. I think my health system's really trying to do that. That's why I'm in a health system, because I'm trying to change it. If we do that, then we have a path to not only change how we practice and change from disease management to healing and reversal, but the patients will finally be in front of people who understand what healing looks like, and they don't have to resort to me and you on YouTube to find that answer. I want health systems to do this work as well.
That's really interesting. It puts it in a bit more perspective for me, and it helps me to understand that this is not just from the patient results side, but also from the doctor's side. It's actually it is a nuanced discussion.
Yeah, and it's more complicated than I share, trust me.
With all those complications, what do you think the future is like for a low carbohydrate style of diet?
Well, I'll kind of frame it through the lens of a health system. I think, let me just say that health systems, again, have to follow the recommendations, right? So if we're being asked to follow standards of care, which are those guidelines, well, we have good news, because the American Diabetes Association now endorses low carb as a dietary option. The Association of Clinical Endocrinology in the US endorses low carb as a dietary option. the American Heart Association now endorses low carb and keto as a dietary option. And I always remind people that when the American Heart Association did it, they also said that with keto, you have to be careful because it's so effective. You need to have oversight. So we need doctors who know how to de-prescribe in order for us to do a good job in that setting. So I think because organizations are moving towards that model, I think that eventually it'll just be at least a dietary option. We're not asking everybody to be low carb, keto, or carnivore. We're just saying we need to make sure it's a dietary option. The other reason why I feel that the future is bright is because